Medicare questions answered by Marci. Dear Marci, I might need COVID-19 treatment. Will Medicare cover Paxlovid if I need it? Ralph in Indianapolis, Indiana. Dear Ralph, yes, good news from Medicare. It is now covering prescriptions for the oral antiviral COVID-19 treatment, Paloxifid, through the end of 2024. You can access it in a couple of different ways. If your Part D plan participates in the Paloxifid Patient Assistance Program, you can have your prescription filled free of cost at your pharmacy. Contact your plan to find out if it participates. If your plan doesn't participate, or you simply don't have drug coverage, you can still get Paloxifid at no charge. You'll just need to enroll in the U.S. Government Patient Assistance Program, USG-PAP, operated by Pfizer. If you are choosing a Part D plan, you can search for Paloxifid and add it as a prescription drug when comparing drug plans costs on Medicare's Plan Finder. This will allow you to choose a drug plan that automatically covers the medication. If you decide on a drug plan that does not cover Paloxifid, you can still obtain the medication through the USG-PAP mentioned above. Stay well, Marci. Dear Marci, the cost of my medications at the pharmacy has suddenly changed even though I have the same drug plan. What could have caused this? Juan, Los Angeles, California. Dear Juan, good question. Drug costs can change throughout the year, depending on which phase of Part D drug coverage you're in. You should know that there are 4 different phases of Part D coverage. The deductible period. You're in this period until you meet your deductible for the year. Until then, your drugs will cost the full negotiated price. Keep in mind that your deductible amounts will vary by plan. Initial coverage period. Once you meet your deductible, your plan will help pay for your drug costs. You'll have a copayment and coinsurance determined by your specific plan. Coverage gap, aka the donut hole. When you and your plan's payments towards a drug's costs have reached a predetermined limit, $5,030 for 2024, you become responsible for paying 25% of the costs of your medication. Catastrophic coverage. You enter this period after you reach $8,000 in your out-of-pocket costs for your covered drugs. Good news for 2024. In the catastrophic coverage phase, you'll have no cost sharing for the remainder of the year. Out-of-pocket costs that count towards this limit include your deductible, payments during the initial coverage period, almost the full cost of brand name drugs during the coverage gap, payments made by others on your behalf, like family and charities, and payments made by the state pharmaceutical assistance programs, SPAPSs, AIDS drug assistance programs, and the Indian Health Service. Costs that don't help you reach catastrophic coverage include your premiums, plan contributions towards drug costs, the cost of non-covered drugs, the cost of covered drugs from out-of-network pharmacies, and the 75% generic discount. A few things to keep in mind. Your plan should track your out-of-pocket spending and include this amount in your monthly statements. As of 2025, the out-of-pocket maximum for covered drugs will be $2,000, and there will be no coverage gap. Your local state health insurance assistance program can help you determine if you're eligible for programs to help lower your drug costs. I hope that clarifies things, Marci.